And we'll go.
People from all walks of life have felt the bite of the rising cost of health care in America. For many of us, healthcare premiums are simply more than we can afford. An article on CQ Researcher, August 28, 2009, states that there are more than 45 million Americans without healthcare insurance. With a cost that's 40% higher than any other country, it's no wonder why so many of us don't have insurance. We need a universal coverage plan that makes healthcare affordable for those with low-paying jobs, with an income-contingent health plan for those who can't afford insurance at all. Today we'll look at proposals for health care reform and the cost involved. And then we'll discuss publicly run health plans, and we'll follow up with questions and answers. Privately run health care insurances have driven the cost of insurance to astronomical price levels, and the number of uninsured Americans is rising just as fast. An article on CQ Researcher, March 30, 2007, reported that there would be 56 million Americans without insurance by 2013. The same article reports that uninsured children who are admitted to the hospital due to injuries are twice as likely to die and 46% less likely to receive rehabilitation after they leave the hospital. Further in this article, it says that healthcare costs threaten pension plans as well. Most retirees purchase supplemental health care on top of Medicare because Medicare only covers part of it, but pension investors are unable to find investments that grow fast enough to keep pace with the rising cost of Medicare and other health plans. Now, government-run subsidized health care plans allow them too much control, and it will lead to rationing of medical services and death panels. CQ Researcher, August 28, 2009, quoted Governor Sarah Palin as stating that government influence in healthcare would lead to death panels, and this accusation comes from concerns that government-financed healthcare means severe rationing of services and allowing Medicare to pay for patients to have end-of-life counseling. The same article states that this type of counseling actually does exactly the opposite. A lot of people patients get painful and expensive treatments at the end of their life because doctors make decisions for them when they're unable to. End-of-life counseling with an end-of-life directive made while they're of sound mind and body would put an end to that. There are proposals out there that would not give the government any control at all, and yet still provide coverage for those who can't afford it. But we need a universal coverage plan that's income contingent but not run by the government. The main proposals keep employer-based coverage in place and add strictly regulated insurance plans for everyone else. It's a regulation of insurers. With this system, we could develop a plan based on depth of need and income level. These proposals require that everyone purchase health care or pay a penalty, even the young and healthy who may feel that they don't need it. This will spread out the cost of health care so that as people grow older, their health care premiums won't raise as high and they'll be able to afford it. CQ Researcher, September 21st, 2012, reports that in 2010, Obama's Affordable Care Act was accepted as law. Set to begin fully in 2014, the law requires everyone to buy health insurance or pay a penalty. It also puts restrictions on private insurance carriers. Universal care plans are the answer to the growing problem of health insurance in America. Such plans are already in use here in the United States, in Massachusetts, and across the globe. If Canada, France, and England can use a universal care plan and make it work, then why can't we? Does anyone have any questions?
How does Canadian healthcare work?
It's universal care. Basically, everyone has to purchase insurance, whether they're young, old, whatever.
There's no government provided?
No.
They have to purchase it, but everybody gets the same kind of a
They all
coverage
get the
plan or
same
whatever?
they all get the same plan. And basically, I mean, even a lot of, like in America, a lot of people, when they're young and healthy, they don't buy insurance because they don't feel that they need it. And that makes it higher, drives the prices up for old people, basically, mainly. But with the universal coverage, everybody gets health insurance. They all pay the same price, no matter how old they are.
So
And
Canada,
what's
for instance.
the penalty then? What?
They're fine. If you don't buy insurance, you'll be fine.
It's like,
What?
wow.
But for those that can't afford it, okay, there's subsidized plans.
Okay.
Okay,
And
so
that's
like,
what's going on in Canada, France, and England.
yeah.
People that can't
And in
afford their
Massachusetts,
insurance.
they've done it. There's a few other states that have done it,
Mm-hmm.
and it works.
Have a similar plan to those three countries.
That's cool.
I don't know if the plan is similar. I mean, it's got to be similar because
Oh,
it's
yeah.
universal coverage. But I don't know. There's particulars that are different for every country.
Yeah.
But okay, and you can help make this happen. Write to your local congressman or state representative and tell them that you want universal coverage. Because, like, for people that are on assistance, public assistance, they may have insurance now, but when you're off public assistance, like I am, my medical ends in 1 year, and I won't have any insurance after that, and I have a child, so we need universal coverage.
Coverage sounds like it'd be the best way to go.
Yeah.
So then you wouldn't have the doctor driving the Porsche situation,
Yeah.
right?
Well, no.
You probably have to beat up
They
on
probably
the
would
other
still
one.
drive their BMWs and their Porsches, but you know.
Still got people who need surgeries and stuff.